We're at Devon Partnership Trust, Wonford House. Another video. It's the 30th of January today, 2024. After some of my other videos I've already done and posted, I had a little bit of a think about things and where I go next. Today's video is more about how I feel with my frustrations, trying to obtain and seek some good support and help with my mental health. I've been discharged from CMHT recently, even though I am still diagnosed with the same conditions and I'm still on the same medication before being discharged, so nothing's changed. I've recently had some incidents with place of safety, first response and site liaison, which is based in the hospital over the back. Just the same utter frustrations. More about how I feel today. I'm just so cross with these people. As I said previously, it's a big concern here. There's plenty of staff here. Look, there's no shortage of staff, and I know for a fact most of these cars here today are staff, because I've been coming here for many years. The appointment room will be empty. I can guarantee it. There'll be no one in there. You'll be lucky if there's one person there waiting to be seen. So there are staff here, lots of staff. The frustrations are like, I've just recently had a contact with my GP, who's been trying to contact people at Devon Partnership Trust, or CMHT, which is Wonford in Exeter, which is where we are now. And even my doctor has noted in his notes that he has tried numerous times to get communication with these people over me having an action plan for some extra additional support and help. My doctor has stated that I am in a fragile mental state, and he knows all too well, like he said to me, that without the support my mental health will deteriorate, and there's a high chance of me having more crisis episodes, which I'd have to agree, because I feel totally abandoned. I feel discarded, of no worth at all. So he's wrote to them and he stated, this isn't acceptable, to the extent in his reply from my GP, my doctor has said, you're just not communicating with him and the GP. He's tried many times and they don't respond. All this big concern and they can't even respond to a GP. He's requested that I get reassessed, and he would like me to be back on community mental health, CMHT. And they're not listening to him. They're completely blanking my doctor, which I find frustrating and not very professional. But that's this place in general. This big old building, it just amazes me. They do what they like here, and no one's auditing them. No one's, banging the table and saying I need support and help. Unfortunately, we live in a country where people just put their head down and walk in shame. And if you're in a mental health situation and on the edge of a mental health crisis, and you can't seek help, it's only going to go one way. You're going to end up in a worse state, which I have been and continue to be. There has to be some more on offer. As I said on the previous video, there's some moorings over the back. It's in the grounds of this building. And when it moved here, I thought it would be a better service, because I never really rated the moorings, to be fair. And I thought by being in the grounds of Devon Partnership Trust that it would have a bit more, be a bit more robust and offer better or more support. If anything, it's got worse. As I said before, they're under no obligation to inform anybody if you're under a care coordinator that you're in crisis when you turn up to the moorings. The moorings opens to midnight. They've extended their hours. But he said to me, we have no obligation to inform your mental health worker or your mental health team or your GP. Which is, how does that help people? Surely people need to know in the right field that you're in crisis. And it's all part of this, you know, it weakens anyone's chance of getting any help because these people just do not communicate with each other. They're in the grounds of this headquarters, yet they don't communicate with them. I find that totally unacceptable. I've now, my carer has now requested my full medical notes from Devon Partnership Trust. We've had this before, and when you get your full medical report, most of your report will be blacked out with black marker pen, so you can't read it. It's like, you know, I have trust issues anyway, but when you see your medical notes are all blacked out, so you clearly can't read it, what's being hidden? What's not being allowed to be, what are you not allowed to be informed of? It happened before. Half of it was blacked out. You couldn't read any of it. They just annoy me beyond belief here. You know, on it goes. But I've met with several people, and I know of many people with chronic mental health issues are either under CMHT or have been discharged from CMHT, so they're actually back to their doctor, which is called primary care, back to your GP. And they all pretty much agree. They feel abandoned, they feel let down, and it deteriorates their stability. It makes them mentally more unstable because they feel like no one's helping them, no one's giving them any support. So I'm not the only one, but at the moment I'm the only one who's prepared to walk the plank and do what I'm doing. You know, people know it's going on, but they're scared to poke their head above the wall and say, yeah, this is happening to me, my family's going through very similar. I just, people need to stand up. If you don't stand up for your rights and ask for help and support through your GP or this mental health services here in Exeter, you're going to be ignored. You're going to be just floated down the river. So, you know, the videos will continue. Please pass your comments. You know, if there's something bothering you, then please post it. I'm not offended by what you say. If you want to curse on the comments and curse and swear with anger, so be it. If it helps you to vent off your frustrations with trying to seek help from mental health services or through your GP, then please post. Don't hold back, because I think it's important that people post how they feel. This is a problem in this country. You know, there's a lot of people who are scared to post. They're scared to express themselves. You know, part of my emotionally unstable disorder is I don't trust people. I have chronic trust issues. But if something's bothering me, I should tell somebody, you know, this isn't right, this isn't fair, I need help. But a lot of people won't. And it's not going to help you. These guys here will just sideline you that you're okay and you're fine. You know? So that's the video for today. And we'll go from there.